It's my honor and pleasure to welcome Dr. George Stansel. Dr. Stansel is the Executive Vice President for Academic and Research Affairs and holds the position of the Roger J. Bulger, MD, Distinguished Professorship. Dr. Stansel will now deliver his comments.
Well, thank you very much, Dr. Baxley. I'm apologizing. I'm not quite as facile with the Second Life as some of the students, but I'm learning, and this is my third year now to speak at the graduation. It's a real pleasure to be here, and I want to first of all bring you greetings and congratulations from our president, Dr. Giuseppe Colacerda, and the whole University of Texas Health Science Center Houston family. I've been a faculty member here for many years, and the two most exciting days and satisfying days for me of each academic year are the day that we welcome new students and the day that we see them graduate. And today I want to congratulate all of you personally on your graduation day. And I do hope you experience a sense of fulfillment at having completed a rigorous course of study, but also a sense of excitement about what lies ahead, using your knowledge in your professional careers. And as you do move on to the next step in your careers, whatever they may be, I'd like you to think about several things. First, don't be apprehensive or have any anxieties about your skills or capabilities. You should have confidence in yourselves because you've completed a rigorous program of study involving the acquisition of new and important skills and knowledge. The SBMI faculty wouldn't let you leave with the degree if you hadn't, so rest assured that you're technically competent. And I can say that I've seen a number of graduates of their school, and they've gone on to do wonderful things, so you should have the confidence that you'll be successful. Second, when you go to apply and use your new skills, for most of you, that will involve working with many people who need those skills and that information, but they may not have had the in-depth technical training that you have had. Remember that for the past several years, you've been talking about informatics with faculty members who are experts or students who are becoming experts in informatics. But just pause for a moment to consider how you will communicate with people who have not had your level of technical expertise and knowledge. Physicians, nurses, professional trainees, hospital and insurance company staffs, and office staffs, and maybe even other new students. Think of how to communicate effectively with them so that by working together you can improve the health of the public. That's ultimately what all of us at UT Health are about. And as you know probably better than I, if we simply give the public new technology and technical skills without helping them gain an understanding and the tools to use those skills, we will likely increase their frustration and actually decrease their productivity. And I think that's perhaps one of the greatest lessons I've learned in my career. No matter how well you know your field, you will not have your maximum impact, and you won't get the most satisfaction you can unless you can work effectively with others who do not have the same level of expertise in your discipline. So think about that and do work continually on your communication skills. And remember, listening is half of communication. Once you have acquired technical mastery of your field, there is nothing more important than to be able to communicate to others and benefit to their benefit and vice versa. I emphasize communications as well as technical mastery of informatics because we need you as new informaticians to work with a great number and variety of people to achieve critically important outcomes like improving patient safety, improving the quality of health care, making medicine and public health measures more affordable and more cost-effective, and by helping people to learn in all sorts of venues, some on-site and some at distances. These are major challenges facing us at this point in our history, both in the U.S. and the world. And this is a very important and, if you and people with your skills in informatics don't help us make these things happen, they simply won't. Let me put it to you in terms that a Texan would use. We're counting on all y'all. So I'm not trying to put pressure on you as you graduate, but only to emphasize the exciting challenges that are out there for you after graduation and the true importance of the work you'll be doing in your careers. So again, congratulations on this your graduation day. All of us at UT Health are proud of each and every one of you, and I know you're going to have terrific careers filled with great opportunities ahead of you. Please do keep in touch, and best wishes to all of you from the entire University of Texas Health Science Center at Houston family. And thank you for the opportunity to be here and visit with you this evening. Thank you.
Dr. Stansel, thank you for those inspiring remarks. We appreciate that you take time from your very busy schedule to come. Next, I would like to introduce Dr. Hongbin Wang. Dr. Wang is Associate Dean for Academic Affairs at SBMI. Dr. Wang.
Thank you, Dr. Baxley. I would like to echo Dr. Zhang and Dr. Stansel's remarks and offer my own sincere congratulations to each and every one of you. The old Chinese saying goes like, may you live in an interesting time. I would like to emphasize that you are indeed living in an interesting time. Health information technology is fundamentally shaping the landscape of future healthcare. Your training in applied health informatics from the School of Biomedical Informatics at UT Health has prepared you with the necessary knowledge and skills and credentials for you to excel and make your own marks in this interesting time. I have all the confidence in you that you will succeed and make a difference. All it takes is that you are brave enough to face and meet any challenges. I'm proud of you all, and congratulations again. Thank you very much.
Dr. Wang, thank you for your remarks. Next, and at this point in this completion ceremony, it gives me great pleasure to introduce my friend and colleague, Dr. Mohammed Walji. Dr. Walji serves as the Associate Dean for Technology Services and Informatics at the UT Health School of Dentistry. He is also the Associate Director and a project leader at the National Center for Cognitive Informatics and Decision Making in Healthcare, which is funded by the ONC SHARP program, which is focused on improving EHR usability. His NIH-funded research focuses on implementing standardized dental diagnostic terminologies, the development of data repositories, and in assessing the quality and safety of oral health. He is a member of the American Medical Informatics Association, Health Information Management Systems Society, the American Dental Association, and the Consortium for Oral Health Research and Informatics. Dr. Walji.
Great, thank you very much, Julie. It's really a pleasure and an honor to be able to address all of you today, and I too express my congratulations to all of you in graduating from SBMI. I myself am a very proud alumni of the school. I graduated with my master's degree back in 2002, and I continued on at SBMI and completed my PhD as well in 2006, and Julie and I were classmates. So I'm very, very fortunate to be a graduate of SBMI. I'm in fact a product of the UT system. I received my bachelor's degree from the University of Texas at Dallas, and then I did my graduate training at the Health Science Center here in Houston. And I was fortunate to be able to continue as a faculty member over here at the School of Dentistry as well. So today should be a very, very proud moment for all of you, because you are graduating from an outstanding school, one of the only schools that trains biomedical informaticians in the country. So one of the things that I have learned when I was at SBMI and through my career, and hopefully you guys can see the slides, and I'm just going to turn around. One of the quotes that I really love is the one that's displayed, where it says, "Sell your cleverness and buy bewilderment." And this is a quote from Rumi, who is a 13th century Persian poet. And if you just take a moment to kind of reflect on what that means, oftentimes when people go and get a degree, such as a master's degree, they're often purchasing a product, right? You pay money and you expect to get a diploma at the end of this. And that diploma hopefully will provide some evidence to your employers or to others that you meet a certain standard, you have certain expertise, you have certain cleverness. But what Rumi is saying is that perhaps that isn't the most important thing, and that you should actually sell your cleverness and buy bewilderment. And I think that is so very true when it comes to informatics, because as I'm sure all of you have experienced, that as you went and looked through the various and diverse areas of informatics, at least I was just stunned by how much I did not know, and how much there was to learn and to explore. And so I hope you kind of take that with you and really think of yourselves as lifelong learners, because I think that is truly one of the biggest values that SBMI provided me. It really showed me how expansive the domain of informatics is, and how much more there is to learn and to do in this field. The other big takeaway that I got, when I was at SBMI, I'd often have people ask me, what is informatics? And perhaps people ask you the same question, whether it's, your child, your spouse, your friends, etc. And what do you tell them? It's often very easy to tell them that, informatics is the same as information technology, or the same as computers or computer science. But I would really urge you to not say that, not to take the easy way out and say it's the same as technology. Those fields are very, very important. But informatics, what I learned, is a scientific discipline in itself, and it adds a lot of value that isn't added by information technology or computers or computer science. So I really like the definition that's provided here on the slide. Hopefully you can see it, where informatics is suggested as the science of meaningful data. If you can kind of look below that, you'll see a little diagram, and this diagram was proposed by Charles Friedman, who I'm sure many of you have read many of his papers, and this was one of the papers, I think, titled Fundamental Theorem of Informatics. It's very simple but very powerful, and you see basically within those parentheses a human head plus a computer, which is supposed to represent informatics, is greater than a human head by itself. And to me, that is really the essence of informatics, where we're not trying to replace an individual, be it a provider, a patient, and a researcher, but we're trying to enhance their capabilities through the science of informatics. And so that's the thing that I really took away when I was an SBMI student, and it's really helped guide some of the stuff that I do and the way that I explain what our field is all about. There are three areas that I'm really excited about in informatics, and I want to go through these areas just very quickly. One of the areas is the impact that we can have on providers. The second area is the impact we can have on patients, and then the third area is the impact that we can have in the science of discovery as well. So many of you are actually healthcare providers, so you know a lot better than I the potential for informatics to support providers, especially when it comes to evidence-based decision-making. I'm in the field of dentistry, And I was very surprised when I got into this field, not being a dentist or an oral healthcare provider, that many of the treatment decisions that actually occur don't really seem to be backed by sound science. And when I kind of delve into this, it's not because of the lack of trying, it's often because there's limited data available for people to be able to make good decisions. So I see that as a great opportunity for all of us to think about how we can help support providers and bring knowledge that either exists or for us to be able to generate new knowledge so that we can really have an impact on helping provide really high quality, efficient, and safe care. The other big impact that I'm sure all of you are very familiar with, many of you are in the trenches of your hospitals who are implementing electronic health records and meaningful use. There's massive amounts of money that has been thrown at this problem over the last few years. And as informaticians, I think we should all be very, very grateful to be working in this area at this time when it's considered to be so important. But many of you, especially if you've taken any of the cognitive informatics related classes, are probably quite familiar that it's not all rosy. Many times when these systems are implemented, bad things sometimes happen. You've all read about the studies where when a CPOE system has been implemented in a pediatric hospital, mortality rates in some cases have increased. You've all read about the various types of medication errors that can occur after implementation of CPOE. We know that in many cases that there's a big hit to productivity after the adoption of electronic health records. So while this is a challenge, I would suggest that these are great opportunities for informaticians like ourselves, because we know intuitively that health IT really must improve care if conducted properly and appropriately. It's just that we don't really know how to appropriately design or implement these systems quite so well. And again, so this is really an exciting opportunity that we must all contribute to. One of the areas that I was really, really excited about when I left and graduated from SBMI was the impact that we can have on our patients. And hopefully you can kind of zoom in and take a look at these slides. And if you look closely at the diagram that I'm showing you right now, and this was actually published in an open source journal, Journal of Medical Internet Research, that you can kind of look up and read the paper. I highly recommend it to you. But essentially you see this stick figure kneeling down, and you can see that it's labeled the hole of ignorance, and this represents a patient. And you see this other stick figure right at the top, and this represents a provider. And the provider is looking down at this patient and saying, take 2 of these in the morning and don't ask me any questions. And if you look at the scale on the right-hand side, you'll see that this relationship between the patient and the provider, here it's a physician, but it can apply to any type of healthcare provider, is firmly tipped in favor of the healthcare provider. And this is often called the paternalistic model of healthcare. Now, if we go on to the next slide, you'll see that there's a slightly different schematic here. You'll see rather than the patient kneeling down, they're kind of being pulled out of this hole of ignorance, by a rope from the provider. The provider is saying, let me educate you, and I can kind of pull you out of this hole of ignorance over here. Okay, so that was empowering patients by kind of pulling them out of this hole of ignorance. The third schematic here, if you take a look, what do you notice here? There isn't actually a provider in the picture. These are all patients. They've kind of got out of this hole of ignorance themselves. And if you look very closely, you'll see that it's self-support, email, World Wide Web, etc. And what happens is, as some patients get to that level, they can kind of run with the information, while some of them, you'll notice that there's a little guy there being a little bit confused. And so obviously not having the provider or some expert in the equation also is particularly challenging as well. And if you go over to the last schematic here, you'll see that there's a patient and a provider who are kind of on that top left corner. They're shaking hands, and they're basically the patient has climbed out of that hole of ignorance through some scaffolding there, like a little steps and ladders. And that's where I think the role of informatics really is, right? Where we are providing the patients with that scaffolding so that they can become well informed enough that they can meet their providers so that they can participate in shared decision making. So this was a very, very powerful paper for me when I was in graduate school. And it helps me to understand, how we can use informatics and tools such as that to, help our patients as well. And after looking at patients, the other area that I think we can impact, and I'm sure many of you are working in, is in the areas of science and discovery. One of the big areas is this idea of comparative effectiveness research. And I mentioned dentistry, where we really don't have very good information on which treatment options are best or most cost-effective for patients. So I encourage all of you to be able to kind of contribute to that. We're collecting massive amounts of data through our electronic health records. How can we really use some of that data to advance the science of our various disciplines? So I'm really, really excited, about all of the areas that we can actually impact practically in informatics. And that was a reason why, I chose to stay in research. I never imagined when I actually became a master's student that I would, pursue a PhD, and even if I did, that I would actually stay in academia. But because of the fact that we can actually have a practical impact in a relatively short term was very, very appealing to me. So again, to end, what I'd like to end with is with another Roomie quote. And I would like to congratulate all of you guys again from getting your degrees from SBMI. And I would hope that all of you aim high and do amazing things. And again, just comprehend this quote here where Roomie says, you were born with wings, so why prefer to crawl through life? And hopefully SBMI, the education that you have, has really been able to strengthen the wings that you have, and at least taken some test flights as well. So you guys are really now really well prepared to do amazing things. So thank you again, congratulations, and I wish you all the best.
Mohammed, thank you so much for that very inspiring talk tonight. I'm sure it's very meaningful to all the students. I truly enjoyed it. So at this time, we will have the avatars line up, and if you will walk across the stage and stay on the stage as I read your name and your capstone project. As you know, many of these projects have been completed as team projects, so you will hear the same title more than once. And I'm going to read the names for all the students that are graduating. They may not be here tonight, but I do want to recognize them in this ceremony. Anand Alam, MD. Title of the paper, capstone paper, is Mobile Technology and Websites for Dietary Tracking, Weight Loss, Physical Activity, and Health Literacy. An integrative review of the literature. John Banks, integrative review of telemedicine, impact to healthcare access, and diabetes outcomes. Gwen Broby, MD, MPH, What App with Mobile Health, a New Paradigm for Healthcare. Jennifer Fox, BSN, RN. What app with mobile health, a new paradigm for healthcare? Barbara Lee, unique patient identifier, barrier to biometry, a review of the literature. Shelby Martin, MS, RD, mobile technology and websites for dietary tracking, weight loss, physical activity, and health literacy, an integrative review of the literature. Kaylin Rykott, MD, mobile devices in healthcare, a review of the literature. Andrew Saldana, BS, MS, MA, ASCP, mobile devices in healthcare, a review of the literature. Joshua Shooter, integrative review of telemedicine, impact to healthcare access and diabetes outcomes. Winston Tavy, MD, integrative review of telemedicine impact to healthcare access and diabetes outcomes. Ruth Unger, BSN, RN, Health Information Exchange, a review of the literature examining the definition as it relates to meaningful use stage 2, evaluating barriers and motivation to participation among primary care practices, and assessing factors for successful implementation. Charles Van Dyne, MD, What app with mobile health, a new paradigm for healthcare. Wendy Wykasey, Implications of Unique Patient Identifiers, a review of the literature. Amanda Wells, Health Information Exchange, a review of the literature examining the definitions as it relates to meaningful use stage 2, evaluating barriers and motivations to participation among primary care practices, and assessing factors for successful implementation. Vera Yang, PhD, MPH, Mobile Technologies and Websites for Dietary Tracking, Weight Loss, Physical Activity, and Health Literacy, an integrative review of the literature. Congratulations to everyone for completing their capstone projects. I know you thought it was a daunting task when you started, but you did an amazing job. I strongly suggest that you think about publishing some of these papers, and I'm very willing to work with you as you find journals or conference proceedings that you think would be appropriate for your papers. So while you think you're done, you're almost done. Additionally, I would like to recognize the dedicated faculty that's been part of the applied program. That includes Drs. Robert Vogler, Amy Franklin, Allison McCoy, Velma Payne, Yang Gong, and to our newest faculty member, Dr. Susan Fenton. And when I looked at enrollment today, Dr. Fenton has at least 17 students coming in for the standards class. So she will have a very busy fall semester. Just for an update, Dr. Allison McCoy has become adjunct faculty and has accepted a full-time position at Tulane. So we will miss her, but we truly appreciate her efforts. Also, I would like to recognize the contributions of Dr. Ed Shee. As you know, Ed is now adjunct faculty as he is a full-time law student in California. And of course, Dr. James Turley. Without his vision, this program would not exist. Dr. Turley retired in July 2012. And this ceremony would not be possible without the support of Dr. Ting Ting Liu and Mr. Marcos Hernandez. They make all of this happen in the way of technology. Dr. Liu has designed and keeps up to date the wonderful invitation that we send out. Marcos does all the recording, and truly I could not survive without their help. In addition, I would like to recognize Dr. Susan Fenton. Susan, when we started the program, was PI for the University Training Grant. So you see it as UTB, and that's our logo that's been on all of the slides to recognize our funding from ONC. We are truly appreciative of her efforts and that the funding that we receive for SBMI. So most of all, we are truly thankful that Susan has chosen to become faculty member here, and that we will continue our wonderful partnership and collaboration with the Applied program, and with many interesting things to come, including looking at becoming KHIM certified and further workforce development. So at this time, this concludes our summer 2013 completion ceremony, and I get to say the sentence that I enjoy most. So, SBMI graduates, you're free to fly or teleport to the location of your choice.